Well, good afternoon, all. It's good to see everybody and see so many familiar faces. As Brad mentioned, I'm Scott Pope. I'm the CEO of Roamed. Well, I'm honored to get to be the first person to do one of these tech talks remotely and virtually. It's nice to see everyone. The topic of the conversation today ended up being very timely with everything that's going on in this unusual world that we live in now. And I'm going to talk about the intersection of consumerism and healthcare. I am just going to kind of break the seal here real quick and say COVID, just to get it out in the air. No pun intended there. But this talk is not going to focus on COVID. I'll talk about it in the context of consumerism and healthcare towards the end of the conversation. As Brad mentioned, we actually have a webinar from one of our physicians that is going to be open to the public for individual kind of lay people to ask questions of a concierge physician about COVID. It's really difficult to get your hands on all the right information. And so we set up a webinar this morning that'll be on Tuesday next week, and I'll share the details as we get into this. But you look at the norms that we have today are completely upside down. And I want to kind of start with, what we have for norms in healthcare. Healthcare is such a unique market that is the things we've accepted as consumers as just kind of normal course of business in healthcare. We don't accept anywhere else in our lives. One of my examples I like to use is we've just kind of accepted it's very normal for hospitals to name themselves on a religious faith, right? We go to Presbyterian Hospital, we go to Catholic Health West, we go to Methodist Hospital, and it's totally normal. But if you apply that to any other business, like have you ever gone to a Catholic Wendy's or gone to a Presbyterian pharmacy? And of course the answer is no. And if I'm Presbyterian, can I be seen at the Methodist hospital? Is that okay? But it's just kind of one of those somewhat comical things that we've accepted is very normal, that there are those faith-based organization names tied to our hospitals. I had a conversation with a good friend of mine a couple weeks ago, back when humans were allowed to get together and meet. We were at a great restaurant here in Charlotte called Comet Grill. Those of you that have been there, one of the better burgers in town, you should check them out whenever we're allowed to be out in public again, or take to go from them right now. And I'll call my friend Brett because that's what his name is. And Brett had asked me, what do you think is the next revolution in healthcare? So he's not in the healthcare space, but some of his customers happen to be in healthcare. And I very quickly said back to him, I said, it's consumerism. And I didn't yell it at him. That's not why the font's bigger. It's just to kind of draw attention to it. But consumerism is really what I think is going to be the next revolution. And he came back, he kind of looked at me with a very puzzled look. He says, why is consumerism going to be the next big thing? I said, well, let's just take an example of how consumerism works in a different industry. So let's look at car shopping, but let's look at if it were a healthcare type of scenario. So if you were going into shop for a car, but you treated it the same way you treated healthcare, here's basically what would happen, right? Is you would identify that you needed some mode of transportation. You would walk onto the lot of a car dealership. You would walk up to the car salesperson and you would say, I need an automobile. I don't know much about automobiles at all. I have no idea what kind of automobile I need. I don't know what kind of automobiles you sell. I don't know how expensive they are. And oh, by the way, most of it's not my money anyway, so it doesn't really matter. And hopefully you're starting to get this image that the car salesperson now is salivating, right? I mean, they can't wait. They're just kind of looking at their friends like, man, I got a heater here. I can't wait to sell this. I'm going to oversell this person everything I possibly can. And as I'm going through telling my friend Brett this story, he's like, that's interesting. What, bring it back into to healthcare for me. I said, well, imagine if you needed to get your hip replaced. And he goes, actually, I got my hip replaced 2 years ago. So I said, well, that's perfect. I said, so, what kind of research did you do on, your surgeon before you went and had the procedure? He goes, well, none. What kind of research did you do on the hip that they actually put in your body before they did it? Well, none. So he just kind of accepted that the everything that was going to be done right, and it kind of is what it is. And I was like, and how much did you pay? And he said, well, at the end of the day, it ended up being $90,000 for the whole soup to nuts for the whole procedure. And obviously not all of it came out of his own pocket, but effectively he had bought a Range Rover. Brett had bought a Range Rover, had it inserted inside of his body from a price point perspective, and did no legwork on it at all. And as you start to look at how we pay for healthcare, and I'll talk about that example here a little bit more in a minute, we look at how the risk starts to shift. And we've seen where the insurance companies have taken on the risk with HMOs back in the 80s. We started to see the health systems take on the risk with accountable care organizations in the 2000s. And now we start to see the shift into more high deductible health plans where we as consumers are taking on the risk for paying for all of the healthcare that we have. And I think as consumers start to be on the hook for more financials, we're going to demand that there's more opportunity to shop the healthcare that we're actually consuming and absolutely paying for as well. And so we all, you look at some of these norms, and we all know that healthcare has some of its idiosyncrasies, and we all know that it's broken. It's actually the one thing we all can completely agree upon is, in this 2020 election, there's not a single candidate that's going to have this sign, right, posted in your yard. Whatever your candidate's name is, 2020, healthcare is perfectly fine. No one's saying that. We all know that it needs to be fixed, that it is broken. And there's a number of opportunities for us to remedy that. And as consumers get more involved, I think consumers are going to be the ones that really drive a lot of this shift and the changes that we really need to see. So let's take another example of how we pay for healthcare, and let's use now a restaurant example. All right, so my favorite restaurant in Charlotte is the Custom Shop. I was heartbroken the other day when I called to get takeout from them, and they've closed temporarily. But I encourage you to go on to Custom Shop and buy a gift card. It's an absolutely great place for date night with your significant other, and a tremendous restaurant, great people, great food, and a great environment. So let's take an example with Custom Shop, right? So you go sit at Custom Shop, you make a reservation, go have dinner, sit down, order food, order a bottle of wine, server takes care of you, bartender takes care of you, chef cooks your food, you have an amazing experience, and you're done eating. So you get up and walk out. You just get up and leave. You haven't paid at all, right? And so a month later, the Custom Shop sends you an invoice for your meal, right? And you didn't know what the prices were because there were no prices on the menu for anything. And you've now been invoiced by Custom Shop to pay for dinner. And then, so you pay that invoice, fine, happy to pay for the food. A week later, you get another invoice from your server. Well, your server was an independent contractor. She's going to send you another bill, right, for her services. And you have to pay for her service plus tip her out. And I know, by the way, the bartender, has to charge you now for the bottles of wine that you had, plus for for their service, because they're also an independent contractor and it's a completely separate service. And in fact, this scenario plays out all the time in healthcare. With my dermatologist, every time I call it my weight loss plan when I go to see them because they always take giant chunks out of me. I'm blessed with my German Irish skin that I have. So I pay for my visit at my dermatologist, and then they send off to a lab all of the samples that they had. And so I get a bill from the dermatologist, I get a bill from the lab, and I have to pay for all these things completely separately. So if we were to accept that as a norm that we have accepted in healthcare, and we would accept that in restaurants, the world just seems to completely turn upside down, even more so than it is right now. So there's, again, examples of norms that are totally bizarre in healthcare that we've accepted as consumers. Let's stick on this model though of how we pay for our healthcare, and let's use car insurance as an example. And I think this will get to the root and really get us to where I think there's some immediate activation for us as consumers to get more involved in trying to drive the future of where this consumerism really intersects with healthcare. So let's take car insurance and say we all have, those of us that have cars, we all know it's mandatory to have car insurance, and car insurance pays for accidents when we have them, right? It's liability insurance. Well, does car insurance also cover your oil changes or your gas fill-ups? And hopefully that's a little bit comical to you because, of course, in no way, shape, or form does it ever do that. And if it did, car insurance would be dramatically more expensive. It'd be much more inefficient, and it would be a very unsatisfying experience for everyone involved. Well, take that model and say, look at health insurance. And in fact, we now have a single health insurance plan by and large, and it covers your major medical events, right? You have to have a surgery, you get in a car accident and have to end up in an ICU. It covers your preventative care visits, and it covers your acute episodic care, right? Where you may have a flu-like illness, for example. And we wonder why health insurance is so wildly expensive, inefficient, and very unsatisfying. And it's no wonder that the insurance plan that we've built around healthcare really needs to be decoupled. And we need to separate out these things, the preventive care, acute episodic care, into completely different buckets and envision the way that we pay for that completely differently. And so this is really where the notion of membership-based medicine comes into play. Membership-based medicine has a number of different names, oftentimes called concierge medicine, direct primary care. I will just call it MBM because it's a mouthful to say otherwise. But effectively what MBM is where I really think this is the intersection of consumerism and healthcare. And what it entails is, as a patient, we pay a fixed monthly or annual fee to a primary care physician. All right, so this is the doc that's taking care of my diabetes, my annual physical, when I come down with an illness or sickness and I need to be seen on an acute outpatient basis, but I'm paying them a fixed monthly or annual fee. For that, I get a set volume of services. The models can vary a little bit in terms of what's included in those services, and the annual prices can vary quite wildly as well. When you look at some of the practices that are can be as low as $100 a month I'm paying that physician, and others range upwards of $40,000 a year, depending on the type of model, the provider that you're getting access to. How they bill your insurance also varies wildly by practice. Some of them will in fact bill insurance for any additional costs that are incurred if you have to have some type of chest x-ray done or additional testing, lab testing done. Some of the practices will bill your insurance, others will not do that. But this is really where you start to see this complete intersection of consumerism and healthcare, and it's actually a win-win scenario across the board because it's a better place for the physicians and the consumers as well. Sorry, I didn't want that to pop up just yet. So from a physician's perspective, they get to manage fewer patients. They have more volume and revenue stability, and COVID-19 is a perfect illustration of that actually being the case, where many of these primary care physicians that are in what I'll call a traditional reimbursement model, where they actually have to have people coming through the door, patients coming through the door all the time, because that's the only way that they get paid, are unfortunately in a position where they're laying off staff. I talked to one of our Rome physicians in Indianapolis right before this call, and he talked to one of a primary care physician who is in traditional medicine, and they're laying off 8 of their nurses right now because they don't have the volume. They don't have money to be able to keep their doors open. And meanwhile, Matt, the physician I was talking to, is they've already have access to all of their money that they're getting because it's not based on actually seeing patients in real time in the office. So these physicians have more time to spend with each patient. They've got a better work-life balance. And then from a consumer perspective as well, COVID is the perfect illustration of this entire scenario, where if you're in a traditional reimbursement model, the physicians in primary care are seeing between 2,000 and 3,000 patients in their panel. In an MBM model, they're seeing between 20 and 400 roughly. And as I was talking to that physician in Indianapolis earlier today, he's actually made phone calls to every single one of their patients to check in on them. He's not waiting for them to call in and say that they're sick. He's actively reaching out. And so it's that type of touch and that experience and that relationship you build with your physician that is much greater. In this COVID world, if you have to go in for an episodic visit, you're going to run into much smaller waiting rooms in an MBM type model, and much shorter lines, if there are any line at all, to get access to those physicians. So I know that folks probably, given that I'm an infectious diseases pharmacist by background, wanted to talk about COVID. I'm happy to take a couple questions if we have them towards the end. But what I've actually set up is one of our concierge physicians that's here in Charlotte, Dr. Phil Lackey at Signature Healthcare, agreed to do a free webinar that's open to the public. So an opportunity as a kind of for lay people to ask questions of a concierge physician around COVID is a free webinar that we set up. It's Tuesday the 31st from 7 to 8 Eastern. You can see the registration link there, and I'll be sure to share that with Brad as well, so he can send that to the group. Just an opportunity to have an open dialogue and conversation. It's so difficult to get access to legitimate, reliable data right now around COVID, and I thought this would be a great opportunity to get you some exposure to what a concierge physician is able to do as well. So now the opportunity to talk about Rome. So those MBM practices are exactly the audience that we help. So we're helping to unite them and help their practices succeed at the end of the day. Rome has around 100 member practices globally. Most of those are here in the United States, but we do have practices in Hong Kong, in London, and a couple in Canada as well that we're growing out. But the way that we help these physician practices, these MBMs, succeed is by enhancing continuity of their exceptional care. So we do something we call travel reciprocity. So let's say you're established with Dr. Lackey here in Charlotte, but you happen to be in Seattle, and you have a healthcare issue that arises that you call Dr. Lackey as your physician, and you do a telemedicine visit, but Dr. Lackey decides that you need to be seen, right? I need somebody to do a chest x-ray. I need somebody to look at that central line that you have in. I need somebody to actually put hands on the knee injury you have, whatever that might be. Well, with Rome, the Rome physician in Seattle will treat you as if you're already an established patient in his or her practice. So that travel reciprocity gives you the ability, instead of going to an urgent care or an emergency room in those scenarios, you actually get to see another concierge or an MBM physician that will treat you as if you're already established. So we help them with that care continuity in that way. We also help these MBMs with reduced overhead cost. I see my Rome Senior Vice President of Strategy and Practice Cost Management on the webinar. Mary Stokas is on with us today. So Mary helps us with all of our supply chain opportunities, where we're able to save these practices money and all the stuff that they buy to keep their doors open and deliver exceptional care to their patients. So we're able to save them money by uniting their spend and convening them under the single Rome platform in order to get that done. We also help them get exposure to patients and attract new physicians as well. This webinar around COVID is just a great opportunity for us to do that with Signature to help them grow their top line revenue as well. But we are a tech-based company, so we have an IT platform that gives them the ability to connect and to collaborate and to work together. I'll share the slides out with Brad. I wanted to include just some success stories of how we've actually been able to help these practices. There's a few of them here that I'll let you guys read on your own at another time. But basically, helping them with the connectivity of the network, giving them a sense of community, enhancing practice visibility, and really the travel reciprocity are the types of things that we're doing to help these MBMs succeed, which, again, back to that intersection of consumerism and healthcare, regardless of what hat every one of us is wearing today, if you're in healthcare, you're not in healthcare, we're all consumers of healthcare, and demanding a better patient experience and engagement relationship with our physicians is something we all need to demand more of. The last thing I want to say before I close out and turn back to Brad, and happy to do a little bit of Q&A. We are a Charlotte-based business, and it has been very fulfilling to find a very comfortable home here in Charlotte. We feel that we've got access to absolutely amazing people, amazing resources, staff, people who are seasoned and experts in healthcare across the board in a number of different verticals. We've actually, some of the supply chain partnerships that we've made are through an organization that's also based here in Charlotte called Premier. And it's been just a great place that we found to be home for our tech-enabled healthcare business. And so I'm very proud to be the CEO of Rome, to be able to join you guys today remotely. We're proud to be one of the shining stars in Charlotte, and I've had this chance to share a little bit of our story with you.